Hi everybody, this is Prasant Naidu here from Lighthouse Insights. Carrying forward our conversation series, today we have Mitesh Bohra with us, who is the co-founder and CEO of Savetime. Savetime is a network of patients and doctors.
A little bit about myself and my founding team. I come from Indore, and after I graduated in '96 from the engineering college over there, we three of us, three friends, who all of us were always together during the college days. We used to hang out quite a bit. We all ended up in different Tata companies, and this is '96 through '98, '99 timeframe. In Mumbai in 1997. So the other two co-founders, Siddharth Sethi and Avinash Sethi, they're not brothers, they just happen to have the same last name. All of us were sitting at a park in Andheri, and one of the fundamental questions that every youngster asks themselves, yaar, life mein kuch karna hai apne ko. We want to do something in life. What is it that we can do here? That really was the seed sown for our entrepreneurial journey that began after that. Soon after, in '98, we all ended up in the US. And about 99, 2000 timeframe, when we actually went out on a road trip to Florida, we did not know that this journey would begin. And InfoBeans, our first startup, essentially got set up. This is 2000 timeframe. After that, each one of us ended up coming back, one after the other. Avinash came back in 2000, Siddharth came back 2001, 2 timeframe. I came back in 2004. The idea was, what is it that we can do in our first startup, which is an IT services company, to really grow a strong foundation where customers can be involved. By the time it was 2006, I realized if we are not in front of our customers, we are losing out on it. And doing a full offshore services delivery model with all of us being in India was just not going to cut it, not going to take it to that next level. I moved back to US. This is 2006. Now, from 2006 through 10, a lot of efforts went in here in India in terms of delivery and operations and growth. A lot of operations and growth happened in the US. We ended up developing both East Coast and West Coast as the territories. Around 2010 timeframe, when we had a pretty good strength of close to about 300 odd people and revenues bordering $4 million, this is when we realized we were in a lifestyle business. A very healthy cash flow, a lot of profits to share for us as well as our people, but something was missing. We were again sitting at a park, this time in the US, and talking, yeah, life mein, what's the next thing we want to do here? And that's when we all discussed and decided, let's diversify, let's expand ourselves so we can end up in not only software services, but also software products. We've always had this entrepreneurial bug in ourselves to go back to the roots, do something all over again. And in that process, Savetime, or the idea of Savetime, came about. I've been personally very, very passionate about healthcare as a space for a very long time due to family reasons that actually made me travel quite a bit back and forth from US and India. The fundamental thing that we always see when it comes to healthcare is it's a very frustrating experience. You are in your own, you're suffering from your ailment. On top of it, you're dealing with the inefficiencies and just complete lack of attention of whatever this ecosystem provides. And that has always bugged me, always bothered me. Something as simple as sitting at a doctor office for hours. Sometimes you have to stand there because there's not enough space to actually wait for the doctor to be seen. And this whole idea of us as customers kind of get thrown out of the window, and you see yourself more at the mercy of the provider ecosystem. Now that doesn't mean everybody is bad out here. So what I thought back in 2010-11 timeframe when we were looking to get into this was, what if we solved some simple problem to begin with? Being in the valley, very Silicon Valley headed, very valley headed, I essentially ended up thinking about a simple algorithm which would help patients get to the doctor office precisely when the doctor is ready to see them. That would save people's time immensely. Huge value proposition for the patients. I made a lot of trips back to India during those time frame, had a lot of conversations with the doctors and asked them, is queue a problem for you? I also asked them, is queue status symbol for you? A lot of doctors, to my surprise, were actually coming forward and saying, this is a problem. We don't want patients to wait. It is a headache in some cases. It is a problem for doctors who are very consumer or very patient oriented, who actually want to deliver good value. That encouraged me quite a bit to actually write the whole algorithm. And by the time I moved back in 2012, after completing my executive MBA from Columbia Business School and UC Berkeley, the idea was, let's just go out there and do some trials here. I've always been a big proponent and a big believer in lean startup and a business model canvas. Essentially put stuff together on my canvas, came here, and with my minimum viable product, essentially started to look at, is this something that can be run in the market, whether the doctors, whether their clinics would like it, whether the patients would actually end up getting benefited from it. So I came to India, started with Pune. We had an operational base from our first startup, InfoMeans, in Pune, which gave me incubation space to begin with. And that sort of created this new journey of me operating in a healthcare space. Interestingly, when we went out there, when we ran some trials with our queuing algorithm, we were put in touch with reality. We were shown the ground realities of India. When you create a very advanced solution which is completely tablet based, dependent on a 3G network with no office infrastructure required, you would think you have created magic. But when you actually end up going to doctor offices and when the receptionist refuses to pick up that tablet in the hand, saying, "Ye mere haath se gir jayega, to meri job chali jayegi," you will never ever anticipate situations like this when you are creating solutions for India, especially when you are sitting in Silicon Valley. So that again led us to a huge amount of new discoveries when we had conversations with the doctors, and the doctors would say, I don't want this guy to receive the notification, I want the other guy to receive the notification because this guy doesn't pay me. And that's when I realized, if I were to aggregate all the nuances of their practices and their processes, I'll end up creating a practice management software and it will take me 10 years to do it. So I pivoted, and this is October 2012 already, 3 odd months of us running the trials and gathering a lot of inputs from the market. It was time to pivot. And again, a big believer in failing early and quickly figuring out the solution that actually works for the industry. At the very heart of it, I've always wanted to do something for the patient community. And so I thought, you know what, let's just go back to that same community and understand where the fundamental challenge lies. By then, we had realized advanced algorithms and all the cool things of the valley is not going to work here. We need to solve something more fundamental, something more profound that can actually go and touch the lives of people. So we went back to the community and we asked them simple questions. What is it that is causing problems for you in healthcare? What is the most fundamental issue that you face today when it comes to healthcare? And we conducted this survey in 2 cities, Indore and Pune. Talked to about 750 people each in the 2 cities, a total of 1,500 odd people. And the biggest thing that came after that was, we have no clue, boss, where to go, because when we are in a medical need, we are twitching our hands, we are helpless. And that was one big thing out there, because you would always believe that in a close community like India, where you would just call your neighbor or call your friend or just talk to somebody to get a recommendation or a review about a doctor, all of that word of mouth, what is happening here? Incidentally, when we were having these conversations, we realized we were talking to migrant population. And that gave us a lot of courage to actually reach out and understand the migration pattern of India. And a huge discovery for us. In fact, a lot of research that was put out there on Google indicated that 1 out of 4 in a large city is a migrant. That's 25% of the population. It actually got validated about 3 months ago when Times of India published on their front page that 1/3 of India is migrant now. That's 33% of the population, and that phenomena is more prevalent in larger cities like Pune, Mumbai, Bangalore, Gurgaon, etc. That is a huge amount of challenges and opportunities for somebody who is not looking at close communities, and you start to think of behavioral pattern changes when people are resorting to internet for information. When you think of information platforms in India, these information platforms are half-baked or they practically don't exist in a manner which will help you make a decision. There are yellow pages, there are just dials of the world out there which would provide you basic information, but at the end of the day, I don't care about just that phone number. I need to be able to make a decision. The online world is completely changing the way consumers are behaving. And when we think about internet, the next revolution is already here in India. India is already leapfrogging from internet directly onto a lot of mobile usage. So when you think of this, and when you think of Facebook and Twitter and the amount of time people spend, there was one article that was published recently around more people or people are spending more time on Facebook than on TV. That's a very big deal as to where the consumer behavior is going. So when you think of a fundamental lack of information system, what we used to lovingly think of and call in the US as institutional void. When you think of US, those institutional voids do not exist, and that's generally true of Western markets as well. But when you think of India, these are very, very fundamental challenges that exist today. Now, there are people out there who are trying to do online appointment booking of doctors, many different things. But what we thought of was, these are logistical hassles. Once I know which doctor I need to go to, I could still walk in. And again, in our research and our conversations with the doctors, that's what we have found. A large majority of them are going through practices where there are walk-ins and a huge number of walk-ins, not appointments alone, with the only exceptions of maybe dentists and maybe some super specialty doctors. So while there are opportunities to be looked at in the transactional world, there is a fundamental thing here to solve first, and that's what we thought we would end up taking. So once we got this validation from the market, once we heard directly from the community that this is what they want, we started to put together that information. Now, as I talked about that institutional void, how do you collect this information? How do you put all of this together? Do you go resort to the internet and look at aggregating everything that's out there? You would pretty much end up in the same soup because that information either is inaccurate or incomplete. So we decided to take a more purist route. We actually took a much harder route that a lot of people, especially in the tech world, would not advise you to do. We ended up talking to the doctors over the phone. We ended up sending our field people directly with apps and tablet solutions which would immediately capture that information. We actually ended up building a lot of that back-end infrastructure to collect and capture that information directly from the doctors. A lot of doctors actually gave us paper forms and physical signatures because we wanted all of that information directly from the horse's mouth. We wanted to make sure doctors were aware of exactly what we are trying to do here, and we wanted their consent. Big thing for us. Anybody could go out there and scrape the data on the internet today and claim they've got this much information. Doesn't mean squat because you are not going to be able to make decisions out of those, and that's where the hard part of our work comes in. Very interestingly, as we started to put this together, we launched Savetime.com in January 2012 with 1,000 doctors, a very humble start to think about. And from then, a lot of learnings have continued to come to us. We have kept in touch with the community. We have constantly conducted user meetups. We have talked to them. I have myself gone out there, picked up the phone many times and called a lot of users on our website and asked them, have we been able to help you? Were you able to make a decision? And a lot of those words of encouragement, when you hear somebody saying, guys, you're doing a good job, keep it up, go out there and do more, that's what gives us a lot of fuel to actually do more. So as we started to develop Savetime, we started to understand information alone is not going to cut it, because that's just one view. What's important here is people rely on other people's word of mouth. Now, if you think of word of mouth in the present day and age, you are basically looking at that pattern moving to online, internet and apps. So we thought, let's start to aggregate all of this information, take it online. That's what the community wants us to do. That's the behavior that we are discovering. Let's do that. And when you triage this information that you are collecting with the community reviews and recommendations, it becomes a very, very powerful decision-making tool. That's what we've always wanted to create. So by the time it was May, June timeframe, a lot of these realizations came in, and we started to go out there at doctor offices, at hospitals, a lot of places where you would actually end up finding doctors. And we started asking them, who would you recommend? Whether your experience was good or not. We started to collect these reviews directly from the patients. Again, a very, very hard part of our job that we continue to do till today, because the biggest challenge in an industry like healthcare is one review can change your perception of the doctor. A good review, a bad review, a lot of these, because your life sometimes depends on it, your health depends on it. It's a very serious matter. You cannot have stuff that is going on fake. You cannot have unnecessary, or you cannot have, I'm going to cut this. You cannot have bots writing these things, or you cannot pay the truck drivers out there, or companies who are employing all kinds of tactics to generate reviews. You absolutely cannot do that. This is something that's very core to a patient's health, and that's where we have continued. That's where we've continued to focus on our energies. As we were starting to collect a lot of these, we realized people were interested in talking about it, but they didn't know how to communicate. When we asked them to write a review, they would write good doctor. They would say bad doctor, not so friendly. That doesn't help the community. So we thought, let's understand what are the important things that people look for from a decision-making point of view. Attributes that would really help patients make those decisions. And we started to again have conversations with the community. What are the things that you look for? You are obviously not medically qualified to either comment or assess a comment about a doctor. So what are the things that would make you feel like, yes, I should go to this doctor? And again, when you look at the human behavioral attributes, these are some very, very basic things. Things like, is this doctor humane? I mean, is this doctor talking to me like I'm a human being? Is the doctor punctual? Is the doctor giving me all the information that I need? Is the doctor listening to what my problems are? Often we would end up finding situations where a doctor is seeing 2-3 patients all at the same time. Or you would end up in a situation where the doctor is just rushing you. A minute, 2 minutes, a whole bunch of medicines, and you go home. A lot of these things we as human beings can still perceive. Yes, you cannot medically provide an opinion on whether the diagnosis was right or not, but what you can do as an individual is whether the outcome was right or not, whether you felt better after a day, 2 days, 5 days, a week, a month, 6 months, depending on what kind of ailment you are going through. But at the end of the day, you're looking at outcomes. Those are the things we started to talk to the community about. Those were the inputs that we started to collect from the people. And again, as one thing leads to another, one thing builds up another, we started to build a very strong community of patients, registered patients who would come to the website, look at the information, request information from us, interact with us, provide reviews, and so on and so forth. And this last 13 odd months of journey has been immensely satisfying, because our doctor network has grown from a humble start of 1,000 doctors to now over 4,300 doctors, which are there on the platform, a community that did not exist. So from zero, when we launched, I was literally the first user on the website, to now close to 7,000 registered patient community, and growing by leaps and bounds. So when you start to see again the effect of this, when you start to have a conversation with the doctor, and now when they understand what you're trying to do, they appreciate you. They appreciate you for what you are trying to do. When you talk to the patients, they appreciate you for what you're trying to do.